Hello and welcome to our video series on identifying and treating structural dysfunctions that are oftentimes root causes of our clients' chronic pains. A critical element of resolving pain in a lasting manner is restoring proper function and mobility to the tissues and structure where it's been lost. Now, that may sound like an obvious statement, but what's not so obvious is that there is a particular element of musculoskeletal mobility and function that most massage therapists never learn about. We're taught about larger movements like flexion and extension, but we're not really taught how to break those movements down and understanding what's happening in the joint spaces when those larger movements are happening. There are these micro motions that are happening in the joint spaces that I want you to understand as the essential building blocks for those larger motions to happen the way they're designed to biomechanically without compensation. So if these micro motions get blocked, that will cause compensations. It will cause excessive tension in tissues, either because they're overactive or because they're underactive. And in either case, it can lead to things like trigger points and adhesions and chronic tensions that our clients oftentimes report as their pains. But underneath those, if we keep digging into the system, we'll find these micro motion restrictions. So let's look at a few examples. A simple example would be with hip extension, hip flexion. The head of the femur needs to be able to glide anterior and posterior in the joint space there within the acetabulum. So forearm representing the femur, hand on top the acetabulum. So my fist here is the head of the femur. As you go into hip flexion, this head of the femur needs to glide slightly posterior in the joint. It's a very subtle movement. And as it goes into hip extension, it needs to glide anterior in the joint space. Otherwise, if that movement becomes restricted, then it's going to set up potentially a whole cascade of compensations. It's going to mean that certain muscles are overactive and other muscles that become underactive in the system. That can lead to trigger points, that can lead to the various symptoms that we're treating in our clinics that may get some short-term relief for our clients, but they oftentimes come back with the same presentations and we may end up treating the same way just to give them short-term relief as opposed to giving those longer results that we should be aiming for. Results that hopefully will eliminate these root causes of their pain if indeed it's coming from restrictions in these micro motions. I'll give you a few other quick examples here of micro motion restrictions. My hand here is going to represent the spine. As we go into lateral flexion, at the apex of the curvature, we have a subtle little glide of those vertebrae in the opposite direction with the ankle joint. When we go into dorsiflexion, the talus needs to be able to glide posterior. Oftentimes it gets stuck somewhat anterior and blocks full dorsiflexion, which can affect the whole pronation and supination mechanics down there and lead to maybe there's pain or discomfort there at the ankle. Oftentimes though, it transfers up as something that shows up as a pain in the knee or a pain in the hip or even higher up in the kinetic chain. Let's break down for a moment what causes micromotion restrictions. Most commonly, it's likely a guarding reflex there that's being signaled by the nervous system. Perhaps there was a previous injury or there's repetitive stresses due to postural habits or just repetitive movements throughout the day that our clients are doing that put a stress on those joints, so the nervous system begins to try to protect and minimize the mobility right there at that central joint level so that there's not too much pressure, too much friction, etc. That guarding response locks up the dense tissues right there. We've got much denser tissues than where we're treating in the muscle bellies. We've got ligaments, we may have capsules, joint capsules, we have tendons connecting there, we've got deep muscle fibers. All of these can potentially have a signal from the nervous system to go into lockdown mode and restrict the movement in that joint as a protective measure. Just to summarize, we've got micromotion restrictions, we've got guarding that's coming from the nervous system, and that's locking down the tissues in and around the joint space. And as a result of all that, we get these compensations in the system that create more superficial symptoms of the deeper dysfunction, like active trigger points. But if we're going to get past just treating the trigger points, we're going to get down to treating these micromotion restrictions, restoring proper mobility there, these subtle little gliding and rotational movements in the joint spaces. Then we're going to start getting more lasting results. Oftentimes resolving the core issues as opposed to just treating symptomatically again and again. So the HESH method is designed to identify where these motion restrictions are and to treat the nervous system, the fascia, and the movement all at the same time in a very efficient and organized manner. And we'll talk more about that in our future videos. I hope this has been helpful, and I look forward to seeing you in the next one.